Okay, welcome everyone to Alex Data Hub 3.0. So today we'll be looking at introduction to research and why we need to do research, right? So what is research? Why are we doing research? And what is the correlation of, sorry, why can we specialize in research? So what is the correlation of research in pharmacy? Please let's disregard that. So I made this slide yesterday, so I let's just discard down. So what is research? Why are we exactly doing this research? And what should I expect when I'm done with this medical research? So research is like backbone of modern advances and innovation in healthcare. Research is basically you finding why and how a disaster can be prevented, treated, or managed. So let's break this down in layman English. So research basically means finding why or finding how a medical problem can be improved. So it's more like an innovation where we find new therapeutic approach to how a medical problem can be solved or treated better or can be improved upon. That is, a therapeutic approach can be improved upon. So this is very critical in finding or in advancing um, medical treatment generally. So let me give a life scenario. You remember during the COVID, COVID looks like a new problem, a new medical problem. Thanks to our researcher who looked at the properties of the COVID-19, then they decided or they discovered uh, therapeutic approach, a very reliable therapeutic approach in combating this disease. And a lot of medical researchers write about this thing to prevent further occurrence and how it can be treated and managed better. The signs and symptoms, and how do you know that okay, you're actually a COVID patient, you actually have this COVID. So research is more like you are finding innovative therapeutic approach in solving a medical outcome, right? We will always need research because there are still a lot of medical problems that are not well known of or um, that are not well known of or that are rare, so they are not well known of, or they are the ones that cannot be effectively treated. We have AIDS are not effectively treated but can be managed. STD, some STD are not effectively treated but can be managed. We have cancer is not effectively treated but can be managed as of today. But yeah, it can be treated anyway. But the treatment successful treatment rate is still very low. So which can be improved upon. That means a lot of things can still be done to improve this therapeutic approach that is currently known already. And also, there are some medical problems like leishmaniasis that are very rare. There are some medical conditions that are very rare, and there are not a lot of treatment approach according to combat this problem. So, which is why it is very important that you know that medical research will always be needed the to further advance this medical treatment, to further shed light on this rare medical condition, and to further advance this medical therapeutic approach. So that's basically what research means and why we are doing research. So research is like a faculty, and under this faculty, it has so many departments. So you will not just say I'm doing research. You must say that I'm doing research, and you must niche down to a role. Sorry, you must niche down to a particular niche because you can't do every part of research. So we have the public health, right? Public health, we have biotechnology, we have the bioinformatics, we have drug discovery, we have clinical research, traditional medicine, we have infectious disease, we have AMR, we have as antimicrobial resistance, we have pharmacogenomics and precision medicine, we have maternal health, we have oncology, we have drug abuse and misuse. And trust me, this is not an exhaustive list of all the needs that can be done with research. We also have contagious disease, non-contagious disease. We also have non-infectious disease. We have a lot. Even public health can still be divided into many branches. So, which is why you have to know that you have to just stick with one. You have to niche down to one particular niche of research. So, what is public health? Public health is basically any any medical research that focuses on the general public. There are some medical problems that are faced by the general public. We have, let's say, malaria now. Malaria affects a lot of people, or 90% of people in this part of the world, right? So, as a public health researcher, you focus on preventing disease and also preventing a better way to manage or prevent this disease at a population level intervention. So these are what you are expected of if you are niching down to public health. Public health is basically any medical problem that is facing the public, that is facing the population, that is facing the community, the state, the region you are living in. Or there are some medical problems um that are that are regional, right? That are specific to some races. So public health is you focusing on this population or this specific population, or and how to manage them, prevent them, and new therapeutic approach. So basically, that's what public health means. So what is biotechnology? So biotechnology applies biological principle to develop new products and medical treatments. So this is an example. Vaccine. Vaccine is using sometimes dead or sometimes weakened but live microorganism, right? Sometimes dead, sometimes weakened but live microorganism to which is injected to human body to actually develop immune system, more like a memory cell. So what am I trying to say is that vaccine that we are given, it's more like a dead cell of microorganism or sometimes weakened microorganism, but they are microorganism. They are being injected into the body. Now, these microorganisms are living substance. They are bio, that is, they have life. So we are using this life to actually um, treat a medical condition, which is why we are saying we are applying biological principle in the medical treatment. Also, it can be used to develop new products, right? It can be used to develop new products. It can be used as a new technology. So I don't know if you have heard anything about macrophage. So macrophage is, I don't want to call it a virus. So macrophage is more like a virus, right? Which is used as a delivery mechanism, right? To organize. Okay, let's not go to the deeper part. So more like using a microorganism, let's say the macrophage is a microorganism. Then we inject something inside the macrophage, macrophage, right? And then this macrophage navigates its way into the human body and then release this thing. The thing we injected to it as as a therapeutic action, right? So this is what we call, and that macrophage already, it is serving as a delivery mechanism. So it is a technology, it is a new and developing technology currently. So which is why you can use live organism or anything that has life as a way of producing new products, producing medical treatments, and also improving our technology to deliver uh, therapeutic action where we need it in the human body. Also, we have bioinformatics. Bioinformatics is more like data analysis, but in this case, you are interpreting biological data. You are interpreting the human genome, and you are interpreting individual genome. Sometimes it might not be individual, it might be a population genome, it might be a race genome, right? What is a genome? For every one of our action or for every trait, both the physical, the one that are dominant and the one that are recessive, or let me just say the physical trait that you can see in a human body, they are decoded by what? By a genome, by some codon, by some proteins, right? So there are, let's say sickle cell, for example. For sickle cell, there are codon that are coding for sickle cell, right? So um So using bioinformatics, you can easily see the protein that is coding for sickle cell, and you can easily remove it, right? Once you remove it, you inject, or you remove the bad bad codon, then you replace it with a better codon. So in a way, the protein coding for sickle cell will be gone forever, and then it will be replaced with the one that is not causing that will not cause sickle cell. So uh, this is a way of thinking about therapeutic approach also. So this is one of the developing fields. Bioinformatics is one of the developing field, but it looks like something that will take over in the future. Also, we also have drug discovery. Drug discovery, it does not take the conventional route where different drug component or different plant components will be tested out in the lab, and we would look at which one binds to the target receptor better. So in this in the in the during this current regime, or during this advanced technology time, what we do now is what we call computer-aided drug design. We basically use computer to screen a lot of plant components, and we look at which of these plant components will attach to the target receptor better. In this, the one that attached to the target that attached to the target receptor beta will have a better therapeutic outcome, and this can be confirmed in the lab, in the wet lab. So that means the computational approach does not really eradicate the wet lab, the laboratory experiment, but it makes it faster and easier because you already know the target plant components you are looking for, and you already know the binding ability of these target plant components. So which makes drug discovery faster than ever, and the rate at which drugs are being discovered to treat medical problem is now on the high side. So we also have clinical research. These are for my medical personnel, and also for my people from different background, anyone interested in clinical research. We also have clinical trial. So basically, clinical research is we conducting the safety and efficacy of new treatment. So I also call it clinical trial. So clinical trial is more like, what is the side effect of this drug? You can say, what is the side effect of antibiotics in a maternal sorry s- yeah, during labor. What is the side effect of antibiotics during labor? So you might do something like that. So you are doing the clinical trial. So is it positive? Is it negative? How can it be well managed? What is the dosage? What is the best dosage? What is the if you have this side effect, should we substitute this drug to this? Should we substitute this drug for this? Should we continue using this drug? Is this the best therapeutic approach? So these are what we call clinical research. They basically conduct study on how to evaluate the safety and efficacy of medical of new treatment therapy and medical devices. So we also have traditional medicine. So they explore the potential of traditional remedy. So in modern healthcare. So one of the major obstacles that is being faced by traditional medicine is that the dosage are not regulated, right? The dosage are not regulated. The and also some components are not useful for the treated medical condition. So let me just explain it in a layman, because I know not all of us have medical background. So let me just say it in a layman's word. So for traditional medicine, you prepare a concoction of different plants. So for each plant, they might have different drug components. So and some drug components might not be useful for the treatment of a medical condition, let's say malaria. So if you are using dongoyaro now, even though dongoyaro can be used to treat malaria, but not all components present in dongoyaro can be used to treat malaria. So these things are not, and also the dosage. You never know if you are taking a teaspoon of this traditional medicine, or you are taking a cup. and what is the size of the cup. Never know the meal. And yeah, the dosage is not well regulated, but I feel like with small research, it can be regulated, and yeah, all of these concerns can be addressed. So we also have infectious disease. These are the diseases that are infectious, such as we have tuberculosis, we have whooping cough, and all of these diseases that can be transmitted from one to another. So infectious researcher that are niching down on infectious disease needs to investigate the causes, the best way to prevent and also when it is being contacted, how it can be treated. So these are the things you will write about. These are the things you shed more light to to the general public. So we also have AMR. So we already know that AMR is one of the growing concern in the healthcare currently. So because people people who are not educated, even people who are educated but they are not educated with the medical knowledge, they take antibiotics at uh any slight inconvenience, right? So they take antibiotics to even when they are not when they are fine, they take antibiotics just to flush their system. So this thing has accumulate to a lot of antibiotic resistance. That is, when the antibiotics is now needed, the body has already gotten used to it, and the antibiotics is not doing the set the intended therapeutic outcome. So it's not providing the intended therapeutic outcome, which is antibiotic resistance. So antimicrobial resistance, sorry. So which is why we have to know that if you shed more light on AMR, how can it be prevented? What is the best way? What is the alternative if someone is suffering from antibiotic resistance? What are the alternatives? What are the best way to manage this particular problem? So we also have pharmacogenomics and precision medicine. So I kind of say this one, I kind of explained this one, and I was explaining bioinformatics. So it's more like analyzing the genetic variation of an individual, but we now develop a personalized treatment approach. What does this mean? So now let's say for every for every individual. Now let me just give you a scenario. So if even if patient A and patient B have the same diagnosis, we might use the same drug for them, and patient A we have they might not have the same therapeutic outcome. Why? Because patient A, when you actually look at the genome that is coding for all the traits of patient A, will be different from patient B. So patient A might be sensitive to some drug, and patient B is resistant to some drug. And this is very common when you are treating arthritis, right? So which is why we analyze the patient genome. So we look at, okay, this particular person is sensitive to this particular drug, but is resistant to this drug. So we now develop a personalized treatment approach. Yeah, it's still a developing field, but it looks like something that will take over in the future. So we also have maternal health. These are writing or shedding light about the maternal, the mother well-being, right, and their children. So we also have oncology. So this is more like the causes prevention, the treatment, the therapeutic approach, the alternative way of treating cancer, how to prevent, what are the causes of cancer, and we have different cancer. So oncology researcher can focus more on this and shed more light on this one. So we also have drug abuse and misuse, and trust me, we have a lot of them. We still have contagious and non-contagious diseases. We have infectious and non-infectious diseases. So these are where you can niche down as a pharmacy. Sorry, these are where you can niche down as a medical researcher. So now let's go down to what we are here for, which is what research paper. So we all want to write a research paper, but we should know that for you to write a research paper, there are some things that needs to be done. So I will be opening my notebook here. So let me go to my watch. So there are some starting structure that needs to be known by us. So let me just take us to the form it's load finished. So we can see we have referencing style, but I would like to start from uh, research paper, structure of a research paper. So let me start from there. Okay, okay. So we have research paper, right? So I will start from types of research paper. So what are the types of research paper, right? So we have the commentary research paper. So we have commentary research paper. We have literature review. We have letter to editor. We have original research. We have we have we have citation. So now these are types of research paper or the most common research paper that we have. So we have the commentary research paper, we have the literature review, we have letter to editor, we have the original research and the citation. So let me just explain what this means and how do we recognize them. So commentary research paper from the word commentary. So it means that you as a person, you as a researcher, you are really not conducting a what a an experiment. Sorry, you're not conducting any experiment. You are only commenting on different research paper that has been done. That is, sorry, you are only commenting on different researches that has been done by different researchers. Let me explain this better. So, a lot of researchers have said something about drug abuse. Right? Maybe they've said something about the causes of drug abuse, how it can be the symptoms, the signs and symptoms, the epidemiology of drug abuse, and the age factor, where is it common, and the social status and all of these things. They've commented on that one. They've written about this one. So you as a person, you will now write a research paper, you now write a paper joining all of these points together. You write the causes, the treatments, the factors, the risk factors, the signs and symptoms, but also you add your own novel idea, that is a new idea to it. Why you think, maybe like a recommendation on how drug abuse can be mitigated in our society. So it has not been written in any of these research paper. So you as a person, you are actually bringing in new you're also bringing in new idea to what has been written already. So this is what we call a commentary research paper. Commentary research paper is basically you reviewing, not review basically, you taking your points from a lot of researches, right? A lot of research paper that has been published already, and then you also inserting your own idea. So it is not you just writing about them. So, but literature review is almost similar to commentary, but from the word literature review, it means like you are reviewing different literature. So that is, you are reviewing different research paper. So now let's say I conduct an experiment today in my own lab. I got that my result is that what can I say? Let's say cancer is more prevalent in men than women, right? So let's say that's my own result. Just for example, please don't quote me. So Literature review, I'll look at other literature. What is the conclusion of other literature? Then I will review both of them. I will compare my own results to their own results. So that's what we call literature review. Sometimes you might just, it depends. Sometimes you might just review the different literature and you would see if they actually agree on the same conclusion. So this is what we call literature review. So that's literally you reading a lot of literature, comparing their results to what you have gotten or what other literatures have gotten. I hope you understand what literature review means. So we also have letter to editor. So basically, this is not very common and uh it is it is based on invitation. I don't think a lot of journal accept letter to editor, right? So it is very short. So we also have original research. So basically, we have three major type of research. We have original research, we have commentary, and we have literature review, which we'll be looking at their subtype later in the course. So we have original research. What is original research? Original research can also be called full research. Sometimes they can call it wet lab research. So they can say wet lab research. That is, it is the research that is being conducted in the lab. So not necessarily in the lab, it can be questionnaire. Questionnaire is an original research. It is something you are conducting yourself. Any experiment you are conducting yourself. Maybe you are distributing questionnaire. Maybe you are conducting interview to patients or to individual walking across the street, or maybe any research that you actually actively participate in is what we call original research. So you are writing based on the result you have, the experiment you conduct, probably the one you are doing in the lab or the one you conduct in doing interview, doing by sharing research or by asking for public opinion. So this is what we call original and full research or wet lab research. So we also have citation. So let's look at how can this now be written. The structure of writing a research paper. Structure of a research paper. So now let's look at structure of a research paper. So I will classify this into two. So but the first major type, I will say the emerald structure. Emerald structure. And we have the I just bring up this name, non-emerald structure. So there is nothing like non-emerald structure. But I just bring out this name just as we understand what I'm trying to say better. Okay. Good. Okay. I believe everyone can see my screen. Now, what is emerald structure? Emerald structure means your research paper is following this structure. That is, the I is standing for introduction, the M is standing for method, right? The M is standing for method, the R is standing for results, and the D standing for discussion. And note for every research paper, you have to start, no, not every, sorry. For most research paper, you have to start with abstracts and end it with what? With this is supposed to be two. So yes. Okay. And end it with what? With conclusion. That's like general thing. So let's look at this. It follows the emerald structure. That is, it follows the introduction, that's the I, and we have the M, which is this one. We have R, which is the result. Now, this A, what is the function of this A? This A is just there, just that we can be able to pronounce the emerald as a mnemonics, right? So it doesn't stand for anything. Why this D stand for what? Discussion. Now, it is pertinent that we know that most of our research paper we start with abstracts and end with conclusion. And even after conclusion, you have to add your reference. So references You have to add your references. So you must know that most research papers start with abstract, then they are concluded with what? Conclusion and reference. So we have the IMRA structure, which is introduction, method, results, and discussion. And this A doesn't stand for anything. I hope you understand that, right? So I'll explain. So now, not IMRA structure. This one, they will start with um abstract, right? They will be abstract. Yeah, they will be abstract. There would be introduction also. So looking at this, we have abstract, we have introduction here, but there is a method here, right? But instead of method, there won't be what method here. There will be something we call body, right? BODY. So if there is no method, there won't be the results, right? So after body, we'll move on to conclusion states straight here. Conclusion and what? Reference. Now I want us to look at it again. So look at this. So look at this. We have the abstract, right? Both of them have the abstract, right? I already said that most research paper have what have abstracts. So now introduction, they have introduction. But instead of method, method is more like how do you carry out the research? So that's why they have method. But in this case, they do not have method because they are not carrying out any research. So when you carry out research, it is pertinent, it is compulsory, it is expected of you to have to get a result for any research that you conduct. Because this non-infrastructure, they are not conducting any research, so it will be body. So discussion, that is discuss on your method and results. So we are not conducting any results. That's still the answer, which is why we have body. Then we move on to conclusion and reference. Conclusion and reference. So what exactly will be in this body? We'll explain this later. So we have this IMRA structure and non-IMRA structure. What do I mean by that? So for when you are writing IMRA structure, these are when you are writing something about original research or full research or wet lab research. It's still the same thing. So that means when you are writing about original research, you can easily see that original research, you are actively conducting the experiments. So which is why you would say the method why you are conducting the method you follow in conducting the experiment, the results you get from the experiment, the discussion and conclusion and reference. But the non-IMRA structure, what do you follow? You follow the what? The commentary research paper, sorry, the commentary research and the literature review. This one, you are basically in your room trying to comment and on different experiment that has been done by various researchers or different papers that have been done by what by different researchers. So commentary and literature review, we follow this structure, the abstract, introduction, and the body, right? Conclusion. When I say body, doesn't mean the heading will be body, right? But it won't be method and reference. We'll look at it when we get there. But I believe by now would already know what's the structure of research paper. Is either the structure is following the emerald structure or it's not following the emerald structure. So how do you write something like that here? So let's look at full research paper. We already see we can see we have abstract, introduction, method, as methodology, we have the result, discussion, conclusion, and reference. So for commentary, you can see we have abstract, introduction. So after abstract, I think I started with abstract here. Okay, abstract, introduction, body, conclusion, and reference. You can see we have abstract, introduction, body, conclusion, and reference. So these are the things you need to know. But like I said earlier, I said not every research paper starts with what? Start with an abstract or even introduction. So when you are writing letter to editor, you start immediately with body, conclusion, and reference. Like I said, letter to editor is not a common research type of research paper. It's something you write sometimes based on uh invitation, right? So now under this body, what is under this body. So under this body, it might be risk factor, it can be recommendation, it can be challenges, it can be consequences, and it can be impact, which we look at. So now let's look at another thing. I want to explain to us what databases are. Database. So what are database? So database are, let me write it. They are public available um, literature. So the public libraries containing um, just gonna we have okay. Okay. Now let me explain. Databases are more like public library or public reservoir where literature or research paper that has been published can be found. Like I said, we have example, we have Google Scholar, we have PubMed, we have Scopa. We have more than this, but these are like the most common databases. So all you need to do is just go to your browser, right, and just click on Google Scholar. Just write Google Scholar. Then you can see we have these are our Google Scholar here. So let's go to another browser. We can write PubMed. Just write PubMed. Then you can see we have our PubMed. We also have Scopa. Scopa. Well, it's not as common as the first two that we have written. So let's look at this Google Scholar. What is Google Scholar? Can you see it is saying that it provides a simple way to broadly search for the scholarly literature. So now let's just click on this Google Scholar and look at it. So it will give you a search bar here. So what does this search bar mean? It means that you can search on any you can search on anything, anything that is of your interest. Like I said, let's say we are saying something about oncology now. You can say oncology, you can write oncology. So if I write something like oncology treatments, let's say I'm saying something about um cancer now. So I can search this one. And the paper that will be, can you see there is a lot of paper that has been published on oncology. Can you see you have treatment in oncology, you have oncology treatment, you have treatment in neuro-oncology, you have treatments oncology. Can you see something based on oncology, right? We have we have oncology treatment here, we have oncology treatment here. So we can see all of these research paper, and you can see it is showing that we have about 2.8 million results in just 0.009. So that means, and also you can search for any different thing, anything. Let's say drug abuse. You want to write literature, you want to write something about drug abuse. And you see we have something that has been published on drug abuse. Let's look at preeclampsia. Preeclampsia is one of the medical condition faced by a pregnant woman. So now let's look at preeclampsia. Can you see you have preeclampsia? So now let's look at I'm trying to go to various fields. Now let's look at AMR, which is antimicrobial resistance. Can you see there is a lot that has been written by antimicrobial resistance. These are where we can get our papers. So let me try another one. What can I write? Uh what can I write again? Let's say something about maternal health. maternal health. And a lot of things has been written by this maternal health. So let's say like you can literally just search any paper. The same thing with PubMed, right? PubMed is also a, can you see it is, they said it's comprised more than 40 million citation, life science journal and online book. That is, these are where we can find different journals, right? So we can, let's start the same thing. Let's start from AMR. Let's search it. You would see there are a lot of papers that has been written. Can you see this particular paper, AMR and Sustainable Development Goals? Can you see it is written by Aslam, Asghar Muzamil, Shafiq, Siddiq, we have Khurshid, we have Rasul, we have Shadri. Now, you can see these are the researchers that comes together or that came together to write this particular paper. So you can see we have different papers on this one. Let's search the same thing, the same search word. I believe I said something. Let's look at herbal treatment here. Herbal medicine or herbal treatments. Can you see? We have herbal medicine for treatment. Even though I'm not really specific, I'm not really specify about what ADMA herbal medicine I'm looking for. Right? You can see we have a lot of things that have been written by a lot of people that focus on herbal medicine. So why do we need all this paper? It should be it should be talked about in our next class. So we also have what does I say? But I think I said something about oncology. Can you say you have oncology, you have oncology, can you say you have oncology? I think about I talked about drug abuse also. Yeah, maybe adolescent drug abuse. So that looks good. So can you see? Even when I specify that I only want to say adolescent drug abuse, can you see we still have papers that has been written on adolescent drug abuse. So which is why you should know that this public paper, these public databases are where we can get our literature on any topic, any medical topic, right? So would look at how to make the most of this literature. But most important thing is that we should know that there is a literature where we can get different papers, different literature, different research paper, different literature and different research. So now, I believe today we are focused on, we have talked about a lot of things. We have talked about what is research. We have talked about where you can niche down and the branches of research. We have talked about the structure of research, and also we have talked about the the structure of research and what database is. Now let's just click on one. Let me go to my Google Scholar. It is my Google Scholar. Let me just write anything like dog abuse. So, goodness. So let me click on read this article and share something. Oh, okay, I have to purchase this one. Anyway, let me just go to so now let's look at this paper. Okay, let's Now let's look at this paper. Now the first thing we can see is that we have abstracts. Can you see? So after abstract, what follows? Introduction. So we really can't say if this paper is following the IMRAD structure or is not following the IMRAD structure, because most paper they start with what? Abstract, then introduction. So after introduction, um we were supposed to see what? Method, but in this case we cannot say anything like that. We are saying something like causes, impact, and consequences of malnutrition in sub-Saharan Africa. So this is the body, which is already telling you that this type of research paper is a commentary research paper. All right, it is already seen. Look, let's look at this. This introduction, we have the cause, impact, recommendation. These are the body. These two and three are the body, right? Then after recommendation, they move on to conclusion. So if you actually look at this, you would see you have a what? A commentary research paper. I feel like we should understand what I'm trying to say, because let's go back here. I already said that from the slide that was presented, from the slide that was presented, I told you that if you want to write abstract, the first thing is what? If you want to write commentary research paper, the first thing is abstract, followed by what? Introduction, followed by body. Then you provide your what? Conclusion and what? And your reference. So this body, what is contained inside the body? It can be what? Recommendation, it can be challenges, it can be consequences. And if you actually look at this paper, if you look at this paper, sorry, you look at this paper, you can see inside this body we have causes, impact, and consequence, which means this is actually a commentary research paper. Now let's try to look at another paper you published so you can see. So now let's look at this one again. So we have the abstract here, we have the introduction here, we have, instead of methodology, we have, can you see it is saying these challenges. So this is already giving you something that, okay, this particular stuff, this particular paper is a commentary research paper. Can you see? So we have, after the body, we have the conclusion, and we have the what? We have the references. So now let's try to do another example. So we can easily, whenever we see a paper, we can easily say, okay, this particular paper is it is a commentary or research or research paper. So we have the abstract here, right? You can look at these abstracts. Now, this background methodology, they are still abstract. I will explain when we get to how to write abstract, right? So we have introduction, that's the first thing. We have method. Can you see we have method here? So this is showing you that this is not a commentary research paper nor literature review, but this is what is an original research paper. So we can see we have method here. We have after method, we have what? IMRAD, we have results. I'm thinking these are the results. I really do not know much about what he's saying here. Can you see we have result and discussion? Can you see it match both of them together? We have result and discussion. That means it follows the IMRAD structure. Introduction, we have the method. Now this is R&D. After R&D, we have the conclusion, then we have the reference. We have the conclusion. We have the conclusion. Let's move on. So we have the conclusion here. Can you see? We have the conclusion here, and we have what's there should be reference. Okay, these are the references here. So which is why you should know that when you are following the paper you want to write, you have to follow the structure. And I believe with this example, you already know how to differentiate between original research and commentary research. And tomorrow we'll continue this class. Like God's grace. Have a great day, everyone. Bye.